Okay, so I'm not going to go over the entire skill. You've watched the skill videos. What I want to do is just point out something when you are setting everything up. Again, I'm not worried about sterility when I do this because we're using the GI tract. But I'm going to be doing something called priming the tubing. So before I put anything in this container, the container and the tubing, I'm going to close my roller clamp. And that is the same no matter if you use a gravity infusion or a tube that goes into a feeding pump. Doesn't matter, you close your clamp. And then, well, if I had a can of Ensure, I'd use that. But fortunately, I don't need that right now. So what I am going to use instead is milk, good old-fashioned milk. So if I had a can of Ensure, this is what the patient had to get. They were going to get it over 4 hours. I'm going to set this up and run it into their stomach over 4 hours. I'm going to just pour it into the top here. All right. Close my plug on the top. All right. I would label it. So this has a spot, this one comes with a label for the patient's name, room number, date, time, and then what did I just put in here. I have to write that down because throughout the day, myself and then the next shift has to verify that what's in this bag is actually what the doctor ordered. So you have to look at the order, what the name of the enteral supplement is, and make sure that that's the correct one. Now sometimes you'll get an enteral supplement that comes in a big bag all by itself, and then it has a separate tube that screws into the bag. But we're just looking at your traditional bags. All right, so I've got my enteral supplement in here. You can see there's nothing going down the tube yet. What we do with drip chambers is we actually squeeze them, and that will pull some of the fluid down into them. Sure, Judy. All right, it's not. So I'm going to hang it up. I have a little hook here. Okay, so before I open my clamp, my goal is to prime the tubing. That means to get all the air out and fill the entire length of tubing with just the enteral supplement. So I am going to take the cap off the end, and then I'm going to make sure, in this case I have a SpongeBob bowl, that I'm going to put the end of the tube in, because getting air out I might run too much out of the tube and some of the enteral supplement might come out, drip out at least. So what I do is basically, let me pull this closer. This is not ideal to do in my kitchen. Okay, so I'm trying to get it where you can see it, but when I open the roller clamp slightly, it should start to drip. There we go. You can see that. Now basically my eyes are watching this length of tubing and watching it fill and all the air come out. And once it's coming out the end, I'm going to close the roller clamp and stop it. So I got all the air out. I have just primed the tubing. Now this is not as, cautionary as me doing this with IV tubing, and we'll go over that in a couple of weeks, because if I get a little bit of air into the stomach, it's not the worst thing in the world. It's not going to hurt them, other than maybe be a little uncomfortable. All right, I'm just going to hang my tubing up. So this is ready to go. It's labeled, I've closed my clamp. Now you have an example of math and how we calculate the drop factors and looking at the drops that are flowing. We put the example in Blackboard. There's a description of it in your text and in your readings. We're not going to focus on that this week. So the actual calculations for infusing something using a drop factor we're going to do in week 13 when we do IV medication math. So you can glance at it, but please don't spend any time trying to figure it out. The answer of how to do it is on Blackboard, but don't waste a lot of time with it. So reviewing the process, I've got this stuff ready, my patient's ready. How high is their head of bed before I start this? I'm going to let you think about that. Okay. I've got my water to irrigate with my irrigation kit. So that's ready. I'm going to do a couple of things, right? I'm going to check placement to make sure the NG tube hasn't moved. I'm going to check residual volume on both. And I'm going to put back in what I pull out. I mentioned we're not going with numbers, but I just want you to know that if you pull 500 milliliters out of someone's stomach, you're probably going to call the doctor and not put it back in. Smaller volumes we usually put back in and hold the next feeding for a while, call the doctor, find out what they want to do. But again, we're not going to test you on those numbers. We just want you to know why you would do that. We're concerned things aren't processing. All right, and then after I've checked residual, I've checked placement, I'm going to flush with 30 mLs of water. Because when I just pulled a bunch of stuff out, that stuff's still in these tubes. So I would flush water in, then I would connect my tube feeding. Look at me bending this tube. All right, that's ready to go. I'm gonna start my infusion, open my roller clamp, get it running. It's gonna run for however long it's supposed to run, whatever the doctor ordered. And then when it's done, then I'm like, oh, that's all they needed. We're done for now. I'm gonna come back, bend this tubing, disconnect. Then I'm gonna take another 30 mLs of water and flush. Because if I don't, this tube feeding stuff is sitting in this tube and it will dry up and harden and clog the tube, and then we can't use the tube. And if somebody has these tubes, they have them because that's how we're getting them their nutrition. So these are just some extra tidbits to think about, because I know those skill videos go fast and don't, get into too many details, but hopefully this will help you out a bit.